epicranius muscle. Epicranius muscle. It has frontal belly, which wrinkles skin of forehead horizontally. Auricular belly, movements of auricle, and occipital belly, movement skin of the head. And this muscle, epicranius muscle, has broad tendon, which is called Gallia aponeurotica. Please, Gallia aponeurotica. Next, muscles which surround eye. Orbicularis oculi muscle, like ring surrounds orbit. It has orbital part, palpebral part. They close eyelids. Lacrimal part. It causes pressure on lacrimal sac, and tears flow to nasal lacrimal duct, to nasal cavity. Procerus muscle and corrugator superciliary muscle. They wrinkle skin of forehead immediately above external nose vertically. You understand? Muscles near eye, orbicularis oculi muscle, procerus muscle, corrugator superciliary muscle. Next, muscles which surround the mouth. Orbicularis oris muscle pulls lips forward. Levator labii superioris muscle pulls upper lip upwards. Levator anguli oris muscle pulls angle of the mouth upwards. Risorius muscle pulls angle of the mouth laterally. Depressor anguli oris muscle pulls angle of the mouth downwards. Depressor labii inferioris muscle pulls lower lip downwards. Mental muscle, same function. Next, muscles which form cheeks. Zygomatic major muscle, zygomatic minor muscle, buccinator muscle. These muscles, together with skin outside and mucous coat inside, form cheeks. In depth of the cheeks, zygomatic major, minor, and buccinator muscles. Next, muscles near external nose. Nasal muscles. They pull nostrils laterally during breathing in. And depressor nasal septum muscle pulls nasal septum downwards. All muscles of facial expression you see are short muscles. They surround or external nose, or eye, or mouth. All these muscles attach to skin. That's why provide emotions. Please, muscles of facial expression. Next, muscles of mastication. Temporal muscle, it fills temporal fossa of the cranium. Masseter muscle stretches between zygomatic bone and zygomatic arch, and masseter tuberosity of the mandible. Please, masseter muscle. Medial pterygoid muscle, lateral pterygoid muscle. All these muscles provide movements in temporal mandibular joint. What movements? They close the mouth, only close. They pull mandible forward, backward, and provide lateral movements. All these movements during mastication of food or during articulation of speech. You understand? All muscles of mastication provide movements in temporal mandibular joint. Next, muscles of the neck. On neck, 3 groups muscles. Superficial, middle, and deep. Superficial muscles. Platysma muscle. It protects vitally important vessels of the neck. What vitally important vessels on neck? Common carotid artery, internal jugular vein. And this muscle protects these vessels from pressure. Sternocleidomastoid muscle. During unilateral contraction, it provides abduction of the neck to same side, but face turns to opposite side. If bilateral contraction on both sides, they keep head in vertical position. Sternocleidomastoid muscles. Middle group muscles divide into 2. Suprahyoid muscles above hyoid bone. Infrahyoid muscles below hyoid bone. Suprahyoid. Mylohyoid muscles of the neck. They form oral diaphragm, inferior wall of the oral cavity. Digastric muscle, it has 2 bellies, anterior belly and posterior. They connect by tendon, white color. Stylohyoid muscle, please. And you cannot show on this chart because last muscles, it lies on mylohyoid muscle from oral cavity, gynohyoid muscle. All these muscles open the mouth. They open the mouth because pull mandible downwards in temporomandibular joint. Infrahyoid muscles. Sternocleidomastoid muscle fixes hyoid bone. Sternothyroid muscle attaches to thyroid cartilage of the larynx. It pulls the larynx downwards. Thyrohyoid muscle arises from thyroid cartilage, pulls larynx upwards. Omohyoid muscle. It has 2 bellies, inferior belly and superior belly. Fixes hyoid bone. Deep muscles of the neck. 2 groups in deep muscles. Scalenus muscles and prevertebral muscles, near vertebral column. In scalenus muscles attach to ribs in difference from prevertebral because prevertebral arise and attach to bodies of the vertebrae. Please, anterior scalenus muscle, middle and posterior. During unilateral contractions, they provide abduction, bilateral flexion of the spine. Prevertebral. Longus cervicis muscle, function same. Longus capitis muscle, it attaches to base of the cranium, to basilar part of the occipital bone, to head. That's why longus capitis muscle. In Latin, head caput, you remember. And the 2 small short muscles, rectus capitis anterior muscle, rectus capitis lateral muscle. They provide movements in atlanto occipital joints. Bending, abduction, adduction. In these joints, only 2 axes, only 2 types of movements. Bending around frontal axis, abduction, adduction around sagittal axis. Next question, regions of the neck. Topography, regions of the neck. What regions on neck? First, anterior region is the region between midline and anterior border sternocleidomastoid muscle. Second region corresponds with sternocleidomastoid muscle, same region, sternocleidomastoid region, please. Next, lateral region between sternocleidomastoid muscle and anterior border of the trapezium muscle of the back. And the posterior region corresponds with trapezium muscle of the back. In these regions, triangles of the anterior region. First, vitally important, carotid triangle, please. Carotid triangle is bounded. Posterior belly of digastric muscle, superior belly of omohyoid, anterior border of sternocleidomastoid. Why vitally important? It contains common carotid artery. At the level of the hyoid bone, common carotid artery gives two branches. Internal carotid artery to brain and external carotid artery which vascularizes organs of the head, neck and soft tissues of the head and neck. Vitally important triangle. During operations on thyroid gland, on larynx, very carefully you must operate in this triangle. You cannot cut common carotid artery and branches of this artery. Next, submandibular triangle. This triangle is bounded by bellies of the digastric muscle and mandible. Contains submandibular salivary gland. And very small triangle, this triangle, which is bounded by mylohyoid muscle, tendon of digastric, and here like loop, hypoglossal nerve goes. Lingual triangle, because it transmits lingual artery to tongue. During operation on this, in the region of this triangle, if you cut lingual artery, necrosis of the tongue, because this artery vascularizes tongue. Lateral region, here two triangles, omotrapezoid triangle, between inferior belly of omohyoid muscle, sternocleidomastoid and trapezium. In middle point of this triangle here, in middle point of the posterior border of sternocleidomastoid muscle, one point of the posterior border of sternocleidomastoid muscle, branches of the cervical plexus arise. They innervate skin of the neck, skin of the auricle, skin of the occipital region of the head. Cervical plexus here. Next, omoclavicular triangle is bounded by inferior belly of omohyoid muscle, clavicle and sternocleidomastoid. Vitally important because contains subclavian artery. Subclavian artery gives branch vertebral artery which vascularizes brain. Subclavian vein collects venous blood from organs of the neck and from upper limb. And in scalenus muscle, you must remember about two spaces. Prescalenus space in front from anterior scalenus muscle also contains subclavian artery and vein. And interscalenus space between anterior and middle scalenus muscle contain brachial plexus. What function of the brachial plexus? It innervates muscles, joints and skin of the upper limb. This plexus very important for innervation upper limb. Next question, fascia of the neck. If question fascia of the neck, please. Frontal section through the neck. Cervical vertebrae. First skin. Please, here skin on neck. Next loose fatty tissue. Here manubrium of the sternum. Under the loose fatty tissue you can see first fascia of the neck which is called superficial cervical fascia. Please. Superficial cervical fascia. It contains platysma muscle of the neck on left side and on right side. And next it closes whole neck. Please. First fascia of the neck called first superficial, cervical fascia. You understand? It contains platysma muscle. Next, second fascia of the neck. Second fascia of the neck. It contains sternocleidomastoid muscles of the neck and trapezium muscle of the back, please. And trapezium muscle of the back. Second fascia of the neck, second fascia called superficial layer of the cervical fascia proper. Is the second fascia. You understand? It contains sternocleidomastoid and trapezium muscles of the back. And it arises from anterior side of the sod fascia of the neck. Sod arises from posterior border of the manubrium of the sternum. It is called, and sod fascia of the neck, sod fascia presents only between sternocleidomastoid muscles laterally, manubrium of the sternum, and hyoid bone. It presents only in anterior region of the neck and contains infrahyoid muscles of the neck. Sod fascia, deep layer of the cervical fascia proper. This fascia sod. Fourth fascia of the neck, in difference from first, second, and third, not curved muscles. It surrounds organs of the neck and the cervical here, larynx, here, pharynx in neck region. And the cervical fascia, it has two layers. Visceral layer covers each organ, parietal all organs. Second fascia of the neck called endocervical fascia. It covers organs of the neck. Fifth fascia of the neck contains prevertebral muscles and attached to transverse processes of the vertebrae. Fifth fascia called prevertebral fascia. Prevertebral. It contains prevertebral muscles and scalenus muscles of the neck. Prevertebral fascia. Next question. Spaces between fascia of the neck. What spaces? First, immediately above manubrium of the sternum, first space. Between second and third fascia, intra-aponeurotic suprasternal space. This space contains loose fatty tissue, venous jugular vessels, and in 13% cases, thyroid ema artery. Thyroid ema artery is the branch of the arch of the aorta. Pressure of blood in this artery very high. If you cut this artery, blood flows to all muscles of the neck. Please, intra-aponeurotic suprasternal space. Second space, between parietal and visceral layers of the endocervical fascia. Between layers of the endocervical fascia. It is called previsceral space because this space in front from organs. Organs in Latin viscera. Previsceral space is the space in front from larynx. It communicates with anterior mediastinum. In anterior mediastinum, vitally important organ, heart. Yes? Anterior mediastinum of the thoracic cavity contains heart. In few cases, for example, inflammations from face descend to prevertebral space, from prevertebral space to anterior mediastinum and cause mediastinitis, inflammation, myocardium of the heart. In this case, temperature 40, function of the heart decreases because inflammation of myocardium muscles of the heart. They provide systole and diastole contractions of the heart. If inflammation myocardium, very bad. Please, very quickly, you must treatment all pathological conditions on face and neck region. If you not treatment, these inflammations descend to heart. Third space between fourth and fifth fascia, between fourth and fifth fascia of the neck, retrovisceral space. Retro, behind organs. Retro is behind. This space communicates with posterior mediastinum. In posterior mediastinum, esophagus, thoracic aorta in posterior mediastinum. You understand there are 5 fascia on neck and 3 interfacial spaces. And you understand, for example, operation on thyroid gland. First you cut skin, next loose fatty tissue, next superficial cervical fascia, next superficial layer of the cervical fascia proper, next deep layer of cervical fascia. After that you cut and the cervical fascia. Only after that you can see thyroid gland. After operation, you stitch each this coat. You stitch each this coat. This question, fascia of the neck and interfacial spaces of the neck and structures of these spaces. That's all about muscles, topography and fascia of the neck.